All right, folks, I'm here again with Dr. Rachel, our functional med doc here in the office, and we thought it'd be helpful to kind of go through a condition we're starting to see a lot more with stuff. It's prevalent in general, but I think over the last few years, we see it more and more and more, and it's thyroid problems. And thyroid issues are a hormonal issue that people have. So I guess from your side of things, like what are some common like signs you see with people for thyroid stuff to be? What are things people need to look out for?
Yeah, so I'd say the biggest thing would be people that are feeling just general fatigue or lethargy. Lots of times people just say, I feel blah. That's a common description. People that are having issues getting rid of weight, people that are gaining weight, kind of a cold intolerance. You can even see it with increase in LDL cholesterol, GI issues, and yeah.
Okay. So let me ask you this in regards to that, like, how do I differentiate between like, I'm not getting good sleep and like the thyroid blah type of thing? Is there anything like that's a little bit more pronounced with thyroid type stuff? Or even the weight loss thing. I mean, a lot of people are like, I can't lose weight. I'm like, well, you eat too much, you don't exercise enough, type of deal.
Yep.
Is there a way for people to differentiate there?
Testing would be the best, but there's also other symptoms of like dry skin, dry hair, and then the cold intolerance thing that kind of starts to pull you down. Lateral loss of eyebrows.
Interesting.
Is also a different sign. But yeah, I mean, people manifest things differently, so it's just a matter of looking at the person's lab values individually that will really point you in the direction. Okay.
What about like demographics of people, like age, gender, things like that? Does that influence thyroid type stuff?
Yep. So you don't really generally see it in kids. It starts to increase kind of each decade, 20, 30, 40s, 50s, 60s. Lots of times because of just burnout, especially women after they have kids. Which is pretty traumatic and you know, hard work on the body, and then it's more common in women. It can definitely happen in men. I've seen it in both, but women are more common.
So females, and then getting a little bit up there in age as well too, middle age. But the I don't want to offend anybody. So I guess let me ask you this: like, what is if you were to explain the difference between how like a functional med provider attacks this versus a traditional medicine provider, like where's the difference there? Because again, most people with thyroid issues have probably been down that traditional med route. Like they want to kind of know like what's the difference here? How are we going to attack this in a different way?
So the two biggest differences would be in your diagnosis and then in your treatment. And on the conventional side, when it comes to diagnosis, most of the time doctors are just running one blood marker, and it's called TSH. It's thyroid stimulating hormone. It comes from the brain, and then it triggers your thyroid to secrete thyroid hormones. So it's just one marker, which in my mind is not all encompassing. So on the functional medicine side of things, we test for, in addition to TSH, free thyroid hormones. So when your thyroid, or the free versions, they can actually exert the effects on the cells.
Gotcha.
We also test for thyroid antibodies to see if someone has an autoimmune process, which Hashimoto's is kind of that word for the hypothyroid side of autoimmunity. And then we also test reverse T3, which is a whole different path of thyroid hormones that kind of signals overall whole body stress, oxidative stress, things like that. So that kind of differs in the diagnosis when we kind of look at the whole picture rather than just looking at one marker that's not even coming from the thyroid itself, it's coming from the brain.
Gotcha.
And then we look at different ranges. So the conventional range for TSH that they're even looking at isn't even narrow enough. That's kind of your surviving range. And then we look at the optimal ranges, which your more thriving kind of range.
Gotcha.
And then, so when it comes to treatment, conventionally they're just given thyroid hormone replacement. And that can work, but there's also on the functional medicine side of things is, why do you have a thyroid condition in the first place? There's several things that can come from, again, the burnout, lots of years of stress, lifestyle issues, gut issues. So we figure out why it's even happening in the first place, and then we treat it nutraceutically, supplements, and then lifestyle change, diet changes, things like that.
What can people expect? Like, again, I know it varies based upon how long a person's dealt with a thyroid issue, but like again, you take a pill and there's an instantaneous, like something changes on there. When you make some of these other changes with that, like what's that process look like in terms of like noticing a change and noticing a difference with some of these things?
So depending on how long you've been dealing with the condition, that kind of dictates how long you start to feel better. But lots of times when people start eating more of an anti-inflammatory diet, they can feel better within days and weeks and things like that. But healing the thyroid or whatever the underlying condition is usually takes weeks to months, and it's a journey. And but it's important to heal from.
But you're actually fixing the problem.
Yeah, rather than just masking anything. Yeah.
Cool. Awesome. Well, we hope you guys got a little bit out of that and get an idea of like what to look for. And again, what we've been talking with these videos, like what's the difference between a traditional medical approach and a functional medicine approach to things. So get in here, give it a try, go through a consultation with her. If you've got any inkling that there may be something going on, find out. The sooner you find out, it sounds like the easier it is to treat these things. So take advantage of the opportunity to find out on there. So again, thanks for joining us.